The nation's biggest pharmacy benefits manager has an answer to Turing Pharmaceuticals' $750 per pill treatment known as Daraprim. Try $1 a pill instead. Express Scripts is partnering with pharma company Imprimis to offer an alternative to Daraprim, a drug that treats parasitic infections. Here now to talk about how that's possible is Imprimis CEO Mark Baum, who joins us now from Washington. Mark, first talk to us about how this alternative to Daraprim came about. Did Express Scripts come to you in the wake of the headlines of this 5,000% increase on Daraprim, or did you approach them?
We actually found out about the price increase, and we actually stocked the chemicals in our facilities and decided to come up with an alternative. And we made a public announcement that we were going to offer an alternative to Daraprim at 99 cents per pill. And I think Express Scripts saw the press release, and they did get in touch with us right away.
Okay, you say it's an alternative. It's also a compounded drug. This is not a generic version of Daraprim, is it?
It is not. It is a compounded drug that we use. We buy FDA-approved components that are made in FDA-registered facilities, and we build our compounded drug from those FDA-approved components.
Yet the product itself, the compounded drug, does not have FDA approval. And there have been some questions raised about the safety and efficacy of the product from companies such as Turing Pharmaceuticals. Obviously, it has a lot at stake here. How do you respond to that?
Well, you know, we've been in business for quite some time. We dispense thousands and thousands of doses of sterile drugs. And in terms of risk, a risk profile in the compounded space, sterile products certainly have a higher risk than the formulation that we've made as an alternative to Daraprim, which is a non-sterile drug. So in terms of the risk profile, I would just say that it's a far less risky formulation. The other issue, though, I think it's really important to note, is that our facilities are all FDA registered and FDA inspected. So we're not doing this in our basements. We're doing this in facilities that are inspected by the Food and Drug Administration.
Okay, so the compounded drug itself is made of FDA-approved ingredients, and the facilities are FDA-approved, even if the product itself is not. What do doctors have to do to use this version rather than Turing's Daraprim?
Well, just like they would write a prescription for one of their patients for Daraprim, instead they can write a prescription for our compounded alternative, and instead of the patient actually having to take the prescription for Daraprim and go to their local pharmacy, the physician can actually fax the prescription in to us, saves the patient a little bit of time, and we send it directly out to the patient.
And the price differential obviously huge with Daraprim. That being said, will Express Scripts then force doctors to prescribe the Imprimis, your compounded drug, as opposed to Daraprim?
You know, I don't want to speak for Express Scripts. They've been terrific partners so far. We're really happy to be able to work with them and hopefully other large pharmacy benefit managers. But I think that the Daraprim formulation will continue to be available, but at $750 a pill, or whatever the discount is that is being offered, if they can figure that out. But we will always be there with our 99-cent alternative. That includes the core ingredient that's in Daraprim, along with another drug that is generally prescribed with pyrimethamine or Daraprim. Okay,
so 99 cents, certainly a huge drop off from $750 pill or whatever it ends up being for hospitals. Why not $50? I mean, you could still make money off of that, and it would still be something that's affordable.
Yeah, our entire business model is designed to be outcome focused, and that's where our company is totally aligned with Express Scripts. We're outcome focused, and we believe in accessibility. And whether it's with an HIV/AIDS medication or our core business, which is on ophthalmology, we have a formulation that virtually eliminates the need for eye drops post-cataract surgery. We make our formulations accessible, and generally speaking, people, when they think of accessibility, they think it's got to be a higher price. We believe in lowering these costs, pushing down drug prices, and that's what our entire business model is based on. And by the way, we make money at these prices. We will make money in ophthalmology and with these other formulations at these lower prices.
You'll make money on the 99-cent pill?
Absolutely. Without question, we make a very nice margin, even at 99 cents per pill. And by the way, we're buying our pyrimethamine, which goes in our formulation, from an FDA-registered facility that is inspected by the FDA. So it's not like you're buying a substandard component to this drug.
So Mark, the price tag here, 99 cents a pill, is that temporary or is it permanent? Is it kind of a teaser rate?
It's as long as I'm the CEO of the company. There's no reason for us to charge more than 99 cents. You know, oddly enough, for Daraprim, the branded drug, it was always affordable, and the pricing was actually very simple. Pricing for Daraprim only became complicated when it was acquired by Turing, and we're not going to make our pricing complicated. We're going to keep our pricing simple, and that's 99 cents per pill.
Okay, we started at the top by saying that you're partnering with Express Scripts to make this drug available, this compounded drug. Are you in talks with anyone else to partner up?
We have been contacted by all of the big names in the pharmacy benefit management business, and we're really excited about our relationship with Express Scripts. By the way, Express Scripts spends more than $4 billion a year on compounded drugs, and we hope to earn the right to eventually help them with other portions of their compounded business. But we have been in contact with other PBMs, and we hope to create similar relationships with them, all of the big PBMs.
All right, well, let us know when you have an announcement to make.
Thank you so much.
All right, Mark Baum, CEO of Imprimis Pharmaceuticals, joining us from Washington, D.C.